Hey everybody, talking a little bit more about surgical treatment options for Hallux Limitus. Because this is a more mild or lower end arthritic degeneration of the first metatarsophalangeal joint, or that big toe joint, we really don't want to be going for our joint destructive procedures. Because of this, I'll typically look at a cheilectomy or a metatarsal arthroplasty, where I take about the dorsal third of the metatarsal and a little bit off the medial and the lateral metatarsal head, and that's going to allow that joint to increase motion quite a significant amount more. When it's a little bit later on, then that's where I may undertake a Moberg Osteotomy, which is sort of like a dorsal wedge osteotomy of the proximal phalanx, and that will help to decompress the joint further, allowing that first MTPJ motion and dorsiflexion to be considerably increased again without destructing anything in the joint, allowing that to function for, hopefully a lot longer. Now, they're both sort of my go-to procedures when it comes to Hallux Limitus. However, when this patient may have, an abnormal subtalar joint axis, they may have, a really flattening arch throughout gait that is abnormal for their foot structure, then that's where I may look at a Hyprocure Arthroereisis or a subtalar joint stent, which will help to correct that medialized subtalar joint back into a more neutral position. This has been found to take some of the pressure off that first MTPJ and really decrease the stress that's occurring and the pain that our patients experience. Now, of course, looking at the x-rays will give me a better idea around this, but I wanted to give you some further understanding of the surgical treatment options for Hallux Limitus, and hopefully you've taken a few different ideas from this. If you're wanting to find out more, hit subscribe, check out some of our other videos, and I'll see you there. Cheers.